Hello, once again, it is still Clevenard.com open project on Clevenard in diaspora, India. Right? And it is a program where we discuss Africa on behalf of Africans in the diaspora. Just like I said earlier, Clevenard.com social networking platform will raise awareness in your community. How do we go about that? They just create content and give you a platform that helps awareness in the product, your services, your environment, your community, state, country, and your what have. My name is Frank and Media, and today we'll be discussing we have a very topic of interest, which is investing in children's health. My guest this evening, Dr. Olubunmi Alabi. She's been a regular guest. He is a specialist medical doctor and also a pediatrician. Welcome to the program.
Thank you very much. And good evening to all the other guests. Good evening to your listeners as well.
All right, and another very viable face on this program is Honorable Lawariwan Ayola. We'll be taking his own points of view in the area of economic value of investing in children's care. Mr. Ayola is the managing partner, LRA Consulting. Welcome to the program, Mr.
My pleasure.
Last, I'll have Ms. Sarila Aranti. And she is the author, OI and disability advocate, and also the founder of Osteogenesis Imperfecta Foundation in Nigeria Network in UK. Welcome to the program.
Thank you so much for the invite. I'm glad to be here, and thank you, my listeners. Good evening.
We'll go straight now to what we have on ground, which is on discussing the osteogenesis imperfecta. I actually had to Google that to know what it means, and I got to understand that it's an inherited bone disorder present at birth. All right. So I'd like to start this interview with Dr. Alabi. You are a pediatrician, which means you deal with children between the age of 8 to 15 years of age. Can we get to know what this disorder is all about, and how do you recognize it in that early stage in children?
So osteogenesis imperfecta is a bone disease, basically, but it's as a result of genetic. It's a genetic problem. It's basically results in abnormality in the strength of the bones. So the bones end up being very, very brittle and easily breakable. Basically, that's the main pathology. There's other things that come along with it, like the way the eyes look. Those are some of the things that initially help us to pick it out. The eyes, the part of the eyes that we call sclera, tend to be blue. They look blue, and so we start wondering what's going on here. But basically, the main pathology is because of the genetic abnormality. The bones are very brittle and they break. They break at the slightest stressor on them. So, yeah.
I wanted to know where you would take it from as a pediatrician, because most of us, when we give birth, we just in the hospital, and a few days after going to bed, you are asked to leave, and most of us don't really have the plans to go taking the advice of experts in this field to be able to know what to do or what not to do.
Yeah.
So I'll take the same question back to the founder of Osteogenesis Imperfecta. I think she'll be able to tell us more about that. And please, I need to come aboard here. I need to give us a general overview, all right, of the ailment itself. What should parents look out for? What should a mother at birth look out for when they put to birth in any hospital?
Yeah, thank you so much for that question. And actually, as the doctor has said, she did mention that is a genetic problem. Definitely, yes, it is a genetic issue, and that is due to the lack of collagen in the bone during the process of formation while the child is being formed in the womb. And when the child is being born, there is tendency for for the child to have fragile bones, resulting to easy breakage of the bones of that of the child. Now, the things that we look at, that we see, one, from pregnancy, once the bump is not growing properly, that is an indicator for you to actually check yourself, to go back to your doctor, to the clinic, and then get yourself checked. And then you can, the doctor probably will send you for a scan. So when it's time for you to go for your scan, it is very important, especially we Africans, we need to be asking questions. When you go for your scan, be watchful, watch the scan, and let the doctor, let the person doing the scan show you what is happening with the scan. They probably, if it's a very good scan, they will pick up some abnormalities, some deformities that is happening with the fetus. You will be able to see it, and those are the things that will trigger a lot of questions from you. Another thing that you can also, that can be an indicator for you once the child is born. Once the child, there is deformity with the child, or there is a fracture, or there is a constant cry that you do not understand, it is better for you to start asking the doctor a lot of questions, especially when you lift up the child and you can hear some kind of funny, creepy sounds on the bone. Talking from my own personal experience, those are the things that we noticed, but we didn't know exactly what was happening. Even though we were asking questions, the doctor didn't really understand, and the dynamics of all that. So those are the things that, a new mother of a child that's got osteogenesis imperfecta should be looking at and asking questions. And if you're not clear, I think the next thing to do is to go for an X-ray. An X-ray will definitely bring it out for you to see. Once it's a good machine that is being used, it will be very clear for you to see that there are already fractures that happened with the child, and probably they are healing, and some of them might not be healing. Then is an indicator for you to take, for your doctor to send you for further tests, to do a genetic test, to do some kind of test to really see that there is a problem with the child, that it's got osteogenesis imperfecta before diagnosis.
All right, thank you for that. Let's not forget that we're actually discussing investing in children's health and its economic benefits. All right, so I'll take it back to the question itself now, which is investing in children's health. Dr. Alabi, before I bring in Mr. Lawal to discuss the benefits, let me get to you. How important is it for us in Africa to invest in children's health? We just made mention of an illness that most mothers are not even aware of. And then you discover at the age of the most children, they grow up with either paralysis of the legs, even at an early stage. And so how important do you think investing in children's health is to the African environment?
That is that's an invaluable question. It is extremely important. In fact, maybe I can throw it back and say, how important is it for Africa to have good productivity in their adult population? Because it starts from the child. So it's extremely important to invest in child health, because these are the ones that are going to become the adults that will become the economic drivers of the society of Africa. So it's, there's so many studies that have been done, that show a correlation between investing in early child, in child health generally, and the cognitive ability of the child, the productivity ultimately, in the child. So yeah, let me leave it at that.
Well, according to you, who do you think should invest? Where should this investment come from?
It's multidimensional. Everybody. Now, when we think about investment, everybody generally thinks, oh, it's all about government. Yes, the government has their role to play. They should make facilities, available. They should, you know, when we talk about health, first, maybe I should define what health is. So health is not just the absence of disease. It's the entire well-being of the child, you know, the mental well-being, the psychosocial well-being, the entire, you know, well-being, the growth, the, you know, the development. So all of that is, you know, and the investments in all these different things, they occur at different levels and by different, you know, groups of people, you know, during the course of, you know, the child's development. So yes, it's everybody really that should invest. It starts from the family. So the parents, the larger family, they all invest in the health of a child. And then, of course, there is the society, the environment. What kind of environment is the child growing in? We've not even reached the hospital, you know, before we now get to the actual facilities, the healthcare facilities. So the investment is at all levels.
Bayola, I need you to come in here. You're actually going to be balancing it up with this economic benefits. But before we get to that, you are a father and I know you've experienced one of two things, child death and the raising of it. Let me take the question back to you. Investing, all right, in children's health. How important do you think it is?
Wow, that's a very good question. Before I comment on that or share my perspective, as Dr. Alabi rightly said, I think we're just talking of health. And I believe we need to have not just health care and as well as well-being. We're talking about an holistic thing, you know, but now we're just talking of health care, in which also the World Health Organization have made that mistake from the beginning when they're talking of healthcare. But now they are not including well-being, which is more holistic, you know, not just about injury or whatever. Now it's not holistic. We are now talking of emotional, physical, cognitive, even occupational, you know, development, the mental, everything is not holistic. As a father and as a well-being coach and as a consultant and as well as a lawmaker or policy participant, I think it's not just imperative to invest in children's healthcare and wellness. It's not imperative. The imperativeness is not rooted in our moral responsibility. It is a strategic decision with profound economic implications. You know, as Dr. Alabi rightly said, it's a multifaceted stuff. And it underscores the interconnectedness of healthcare, social well-being, and as well as economic prosperity of individual as well as of a nation. You know, I would put it this way again. Dr. Alabi really summarized it. You know, so the children, they will grow to be the adult of, they will grow to be the adult, they will be the driver of the nation. And everything begins from their childhood. You know, I would not want to, it's quite obvious from the human capital development because there are many key facets we have to talk about of the children. But now I'll be talking from the economic benefit of investing in the children's health. One, from the human capital development is an aspiration of every parent, every ward, to see their children attain their full potentials. But without adequate or a balanced healthcare and wellness, there is no way, it's not possible for any child to fully attain their potentials. There are a lot of research, there are a lot of studies that healthy children are more likely to reach their full potentials in terms of their cognitive, physical, and emotional development. For this to happen, they need what? Improved nutrition and access to good health care, which will basically contribute to their educational development. Once a child has access to good nutrition, good health care, supportive environment, definitely that child will definitely be going to school regularly. He will be attentive in class, and the child will definitely come out to be productive to him or herself and also to the society. And as Dr. rightly put, a productive adult. That is where I will stop for now. Thank you.
All right. Thank you so much, Honorable, for that foundational. Differently, or definitely, we are going to go into the importance of good nutrition and access to good healthcare as the progressing. But Mrs. Avanti, I need you to come in there with your own explanation, all right? Why we need to invest in children. Let's get to hear if you have a different view from Honorable or from Dr.
Thank you so much. In fact, this is a very important question that we are talking about discussing here. First of all, if I look at it I like to look at things from the very basic level. And because I know we've got doctors here and they might be using some kind of big words or, coming from a different higher perspective where the ordinary layman, uneducated woman or man out there might not even be able to understand. So I will be coming out from that aspect. Answering that question, in Nigeria, you answer a question for a question. So I think I'm going to do that right now. When you ask that question, who do if a child or a person is not eating, or if a child or a person is not healthy, what do you get out of that person? You get nothing, absolutely nothing. So it is for a nation to grow. Like, while I was just thinking about the whole thing, I said to myself, do you want a healthy nation? Do you want a healthy economy in your nation? Then it is very important to, invest in the healthcare of children, because the children are our future. They are the future of the nation. They are the future. And if we must have a healthy background of economy, and if we must have the economy move forward in the right path and in the right direction, it is very important to invest in the economy of our children, in the healthcare of our children, because they are our future. They are the one that will rise up tomorrow to be able to produce. And as long as I'm concerned, it is baggage in, baggage out. Is whatever you give in to somebody or to a computer, the computer brings back to you. So if they have the right development where their health is perfect, their health is well, they will grow up, as Dr. Alabia said, to be individuals that will give back to the economy, to that nation. So in my own perspective, it is very important because there is no way we can have a nation, a good nation, a proper working nation, or a proper working economy without bringing the best out of our children. And for me to just add, this is not just the basic health for the children. It is not just responsibility, or it is not just what they need to have. It is their right. It is their right. And if we are not doing this, if we are taking that right away from them, I don't think we are doing what is right, or we are doing, we are doing well in our own responsibility as adults for the children. As Dr. Alabia said, it is the responsibility of every single person, including the government, to look into the investment of a child's healthcare. Because I work with children that have got this disability, that have got these health issues. I can just imagine what their life will turn into if there are no proper health facility for them to go into hospital, take care of their bones, take care of their bodies when they are, when they are not feeling well, or when they have a fracture, or even when a woman is pregnant and there is no proper nutrition for that woman that will pass down to the child. And then when the child is born, for a proper after birth, going for your immunization, feeding well, feeding the child well, having a holistic, looking at the holistic side of that child, where you have the proper feeding, the mental health of the woman is okay, the mental health of the child is okay. And as they grow, they will be able to put, back into the society. They will be proper, they will grow well for for themselves, to be able to put something on the table for them to have a family, and also, for the growth of the economy. So I think it is very, very important. Without that, for us to invest in our children, in the health of our children, without that, there is no nation, there is no world. Absolutely, there is no world.
For the health of the children, I did like what you said when you said garbage in, garbage out. In other words, it is what you put in that comes out when a child is born. For example, one is pregnant and she doesn't take in good nutrition, good medicines, and all. When the child comes, the baby is bound to have one kind of illness or the other. Now, Doctor, I'd like to come back to you, which is you as a medical doctor, you with children, right, from that age of infants to about 15 years old, so you have much more experience. At what stage should the mother begin to be concerned about the child she has in her womb, knowing fully well that it is what she is with that child that comes out at the end of it?
Well, right through right through pregnancy. One of the things that we definitely, I mean, I don't monitor I don't monitor pregnancies. I start dealing with the baby from the day the baby is born. But sometimes I get called to assist with a delivery, and thankfully it hasn't happened too frequently. But you get called to assist with what we thought was still viable, only for us to get there and the baby is no more. And then we start asking questions. What happened? When was the last time you felt your baby move? Oh, maybe 3 days ago. But your baby did not move in a day and you kept quiet, So it's right from the start. As soon as the baby starts to move, you need to, be conscious as a mom that your baby is active. If your baby is too active, something is not right. Baby is just always turning around and is, forever moving, something's not right. That's an agitated baby. And it just means something is not right within the internal environment. Same thing if baby is too lethargic, baby is not moving, you've spent a whole day, you've hardly felt a move. The gynecologist will tell you need to feel at least 10 kicks or so a day. I remember when I was expecting, they also told me that I must feel 10 kicks a day, minimum. So you as a parent, that's your first investment. Start observing. Have the will, have the will to be invested in this child. I was listening to Mrs. Agante when she, said, it's what you put in, you get out. Sometimes it's difficult to just have a straight line of causation, cause effect like that, because there's other factors that go in. For instance, what I just said, the will of the parents. the level of knowledge. Like a mom who rocks up in the hospital has not bothered, she didn't think it was a problem. Definitely that mom did not intend for her fetus to pass away, but her level of knowledge influenced her decisions, you know. She didn't think it was anything. So the baby didn't move for 3 days and it had actually passed away inside her, you know. So level of knowledge, personal will to do, those are, you know, those are some of the things that, you know, would influence and, you know, the concern. But definitely the concern starts the minute the child is being formed from the inside.
I would like to still continue that. We take care of children right from the time they are born, according to with the experience you've had so far, right? What ailments are there? What should parents look out for? What should a mother look out for when she sees an ailment or those kind of symptoms at the birth of any child?
Sorry, I missed your questions. You said what ailments or what?
What ailment should a mother look out for? What symptoms should a mother look out for when she gives birth to her child?
Okay, so as soon as a baby is born, I always meet them on the first day. In fact, they meet me first before they meet their parents. So I obviously my job is to make sure that this baby came out healthy and it's responding to the new environment in a proper way. Because baby is coming from a certain environment, the organs are operating in a certain way. So when the baby now moves from inside the tummy, where, you know, I always tease the babies and say, oh, you were living like a fish before, now you get to be a person, because now you're coming out from that, you know, water, the amniotic fluid, and coming out to dry land, you know. So the organs change in the way they behave. The lungs that were not functioning before have to now start functioning. The heart has a way that the flow now changes to adapt to the fact that now the lungs are working. The heart and the lungs start relating with each other in a way they didn't relate with each other inside the tummy. All of that, it's the job of the pediatrician or the attending midwife or the doctor to make sure that, you know, all of that is fine and baby is in a good state to be handed over to the mom. Having done that, then mom's work now starts. She needs to start observing, you know. I always say something in my practice that mom is the best doctor for her baby, because she knows her baby better than anyone else knows her baby. When a mom comes to me and is saying, you know, this, that, and the other, I listen. I'm assuming this mom has spent time with her baby. She understands her baby. So that's essentially, you know, now it's my job as the scientist to put together all her observations and now come up with a diagnosis, you know. But it's, you know, as a mom, you need to start observing that what's the color of my baby? Is the color changing? You know, my baby looks dull today. I work in an environment where, you know, there's lots of white babies. So then they will come to me and say, oh, my baby's pale. The baby's pale, not bright peach color that, you know, the baby usually has. So you know, the observation of color, habits, how's the baby feeding, you know. So we give them, obviously, as, you know, medical practitioners, doctors, nurses, midwives, who will give you instructions. Oh, you need to feed your baby, you know, X number of times per day. You need to make sure. One thing I tell them all the time: don't leave your baby to sleep on and on and on and on. You know, some parents will leave the newborn baby to sleep for 5-6 hours. That baby is going to be in trouble. So we do give those kinds of, you know, information or advice going to go home, and then it's up to you to now make sure as a parent that you carry out those. You observe your baby. Is my baby feeding adequately? Is the baby, if the baby is crying, what kind of cry? You know, it's all those little things that are pointers to, you know, bigger things. It's not every big disease that starts with something big, but they are always very, very subtle pointers. And some of those pointers could just be, like Mrs. Aganti said, your baby was crying and crying, and and you didn't quite know, you now raised questions. Why is this baby crying and crying? And it seems inconsolable. I always say crying is the only language a baby speaks. So each cry means something. So if a baby is crying, and you would think sometimes they're crying because they just want some love. They just want you to pick them up, and then you pick them up and they still don't keep quiet. What they were crying about was not love. It's something else. Maybe you thought it's a bottle you feed, and so it just goes on like that. It's all about your powers of observation. You need to observe, know what is normal for your baby, and when your baby now starts to act out of normal, then ask questions.
All right, Mr. Aganti, I'll need you to comment there, because you just talked about women, all right, taking note of these symptoms. It comes, they're always there, they're always obvious. It's just that mothers will be able to know when or what to look at. But most of the time, you discover that even mothers does a lot of that. Because I remember when I had my first child, and he was at 10 days and they gave him to me. As I got him, I noticed that he wasn't breathing fine, all right? He was having difficulty in breathing. So I called the attention of the doctor, or the nurse rather. And then she came and he said, nothing is wrong with your baby. But I wasn't comfortable. He kept doing that, and I had to go to the doctor. And I said, I don't like the way he's breathing. I actually came and they put a pipe in his lungs and then drained out some fluid. It was like filling up to a bottle. All right. And after that, he became very, very right now. Not every mother, not everybody would be able to say things like that. I've seen mothers that have come home with children like that. A day, 2 days old, and they are breathing so drastically, and they are wondering what is wrong with this child, because they were not able to notice it. Right? So I would like to ask Dr. Aganti, what is the place of sensitizing? I'm going to take the question to you, but let's get to hear her own viewpoint. How important is it for mothers to be sensitized in things of this nature, for them to know what they ought to look at, what they ought to be bothered about?
Yeah, as I think for me personally, the mother is the best doctor, as Dr. Labia said. And when you're observing, because from the pregnancy stage, you are bonding with the child. You will know some set of behaviors, how the baby kicks and how the baby does things and all that. When the baby finally comes out, there is that bonding time, and it is that time that you begin to look at a lot of things that are really happening with the child. Talking from my own experience, it is very important for mothers to be very, very vigilant. And when you see certain things, it is very important that you speak out. And I'm talking to African women. We are used to not speaking out. We are used to just keeping short, keeping quiet. And because our kind of doctors, I'm really going to be very, very real here. Our doctors, they are not used to giving good explanation to things. They are fond of the habit of giving orders. And when you tend to see a very brave woman or a very brave father or person ask question, they stand up to the doctor, and then they are not sure about something, they ask a question. You will hear a comment like, from the doctor, do you want to tell me what do you want to tell me my job, or do you want to tell me what I already know? And in that way, you are intimidating the parent or the mother. But no matter what it is, for women out there, for the mothers, you are the best advocate for your child. You are the best doctor for your child. You must speak up at all times, because you are the first person that is actually taking care of that child. You are the first person that actually knows the child in and out, the behavior of every child, of how they do things, and how things are done for them. So it is better you speak up. and then ask all the questions that you want to ask. It doesn't matter the kind of name that the doctor will give to you, or maybe silent you, because if you don't speak out, anything could go wrong at any time. And at the end of the day, the next thing you start saying is, oh, had I known? And you start having regrets. And then from there, it brings a lot of trauma. And then from there, it brings a lot of a whole fresh wounds that, it opens up into diverse things, So I think for mothers, if I'm answering your question correctly, once they see, they should be able to, know their children, check out what is wrong with the child, understand what is wrong with the child. Even if they don't understand, just know that there is an issue. Speak out with the doctor. Check those things back again and be sure that your child is all right. Because if you don't speak, nothing is going to be done. If you don't speak and nothing is done, nobody is going to do anything. You have to take the first step by, knocking that door to be open to you. I remember with my own child, when the doctor asked me to leave and to go home, that we were discharged, I noticed from the very first day the child was born, I knew something was wrong, even if the doctor wasn't talking, because the child, the looks of the child, he wasn't my first child. I could tell, as a mother, that something wasn't right. The child was like a turkey, that you bring out from the freezer. And I was asking questions. Why is this child like this? And the child excessively cried. When you try the first thing, like Dr. Alabi said, you try maybe breastfeeding the child, you try to cuddle the child, you try to pet the child, and the child is not taking all those affections that you're giving the child. Then there is something more deeper that is wrong. Then investigate. And in investigation, that because it's not your field, you need to speak to the experts. And once you speak to the experts, they should be able to give you solutions. And if there is no solution given to you, please intensify your questions to other doctors. The doctors should be able to come together, put their heads together, put a team together to then answer the questions and investigate what is happening with the child, and not just send the woman home or shut her down because you just don't want to do your job. And I don't think that's right. Our doctors in Africa should do a lot better. They should be forthcoming with open hands, to be open-minded, accepting of the woman, no matter what has happened, and then be able to gently, answer the lady's or the woman's question, no matter what it is.
All right, Honorable, let me apologize here. We are concentrating on the women. Why? Because I think you agree with me that more of these things that we are discussing, the women has a lot to say about it because we actually have the experience. I'm not saying that you as fathers, you don't have the experience. So, and please, at this time, I'll need you to lend your voice to this. All right? Now, we've heard what she has said and also what doctor has said about the women taking responsibility of assessing their children or their child to be able to know when to call in the doctor at the right time. And also ask the question about how should one or how early should mothers be sensitized to be able to know when the doctor or the professional should come into the matter. Right? You are a consultant. I'd like to get your view on the media, on the specialists using the media to be able to pass messages of this regards. Honorable sir.
I think you're muted.
Yeah, I think basically when the speaker spoke.
Please, your microphone is muted.
I think it's on now, right?
Yeah, we can hear you.
I think basically depending on the environment, so based on what my co-speakers guess, this is the way they have spoken now. People tend to think that it's all about the mothers. But in the Scandinavian countries, it's quite different because, yes, mothers are more closer to their children, likewise fathers. The paternity leave, they call it maternity or paternity after birth, is six months for each parent, which is quite different from, the way people view, depending on the environment. The father too, both of them need to be You know what I'm saying? Very, very invest in their children in terms of observing. I will make myself a reference. I had my own son through hypnobirth. And every moment we have to be home to do so many things. Because most of the Western doctors are not used to hypnobirth. But now I think that most people now are becoming, they are now talking about it and now practicing it, especially in the Nordic countries now. I think being very observant of whatever is happening and good communication between the father and mother, and their doctors is very, very important. In the Nordic countries there, immediately you give back to a child, the growth and development of that child before the child enters school is very, very paramount. They are very, very on it because they have to allocate for you, or you fill a form, you choose, or they rather choose for you if you don't choose. The doctor, they have to be involved with you in terms of the growth and development of the child before it enters school, so that you will know what is really, really happening in terms of the healthcare and the wellness of the child. Because when you talk about healthcare, they are not even really talking more of whether this child has a kind of, I would say, like maybe autistic and all that. Because for me, I've been involved because my own son is in that spectrum. And it's even beyond the mom. That is why I could say a lot about it. And when Dr. Terebo Agenti was talking about some doctors not being too clear. If you are not clear, you have to re-explain. We have to talk one-on-one, and you have to re-explain everything. And if it's not, we can contact another doctor somewhere else. It's not that because we have the BVC, it was for the children, and you have the local healthcare. Then you have consultants that you could talk to. You can compare across, depending on how interested you are, or you are ready to invest in your own child. Because at the end of the day, it's about the individual and the society. Because developed countries we're talking about, they are developed because they have what? They have healthy, productive workforce. It's not just about the parents. Even in the Western world, I don't know any other places, but most of the Western world, it's not even about you. It's about the society.
Yeah.
Because you don't really own that child. You're just the caretaker. You're just the primary caregiver. And if you don't do it well, they can change, they can change parents. That is one thing people have to understand, that if there's one universal thing that we all agreed upon. The mother is the primary caregiver. And also, the sub-primary caregiver is the father. And the caretaker of also is the government. I will rest my case there for now. Thank you.
All right, Honorable, thank you so much for that contribution. We did make mention of something when we said doctors not being clear in their diagnosis. But I would like to take it back to what I want to say. It is not just about doctors not being clear. It is about the doctor not being concerned about the concerns of the parents itself. Because I also had an experience. When this lady came back from the hospital, I knew that something was wrong with this child's legs. They were invited, and at the same time, the child would cry and cry. But I made sure that we took the child back to the hospital. The lady complains there. But the doctor kept telling us that nothing was wrong with the child. All right? But funny enough, we lost that baby when he was about 7 days old. The child died. All right? I think African doctors, we should begin to look into that. When parents come with concerns like that, and they make their complaints, they shouldn't be urged. They shouldn't be make made to feel intimidated as if they don't know anything about what they are talking about. Right? Now, in case where the doctor is unable to provide the necessary help, what should a parent do at that level? Dr. Alba, I'd like you to come in there.
Yeah, it is quite unfortunate when I hear stories like this about the conduct of my colleagues. It's quite unfortunate. And I think it's environment specific. In an environment where there is a minimum service level agreement between you as the service provider and whoever contracted you to provide that service, then you are duty bound already to to deliver that service according to that minimum service level agreement, and that should be enforceable. I practiced for many years in Nigeria before I emigrated. No one was holding me, I must say. I worked in UCH when I graduated. I worked in UCH. Then I went across and I worked in a private hospital in Lagos. In the private hospital, because it's private, they are likely to listen to parents' complaints that, oh, this doctor didn't, when the parents come and make their complaints, they would, pay more attention. But then I went back to UCH and I now moved on to Luth before I eventually emigrated. At those hospitals, I must say, I wasn't being strictly held to any service level agreements, in terms of my delivery. And I found it was essentially left up to me. I happened to be someone with a conscience. I was also raised by a nurse who worked in that same hospital. So, I had personal factors that were motivating me to be the best doctor. Having emigrated, definitely there is a service level agreement. You will be assessed every 3 months. How are you doing what you're doing? What is the feedback? And I'm even talking even in a government hospital. In a government hospital, the patient gets discharged, they fill out a form and they give a feedback as to how this doctor communicated, the disease or whatever the disease burden or the condition, the morbidity to them, how they felt, how the nurses treated them. All of that, they give a feedback and you will be evaluated based on that. So in that kind of environment, you can't afford to be talking nonsense like, you want to teach me my job. Do you, I mean, that such talk does not even arise. So I think that is something that we need to start enforcing in terms of making sure that somebody is holding doctors accountable to some degree of service level delivery. But of course, for the side of the parents, if you are not happy, you always have a right to demand again. I tell my patients, because again, even here, we have some patients who feel, oh no, the doctor didn't say anything, or I shouldn't worry, but they come to me and you can see clearly they're not happy. And I always say to them, listen, mama, quote me. You can go back to that doctor and quote me and say, I said you have a right to ask, because you do have rights as a patient to ask and, expect to be satisfied. And if you have a right to a second opinion and a third opinion and, ad infinitum opinions, it's entirely your right as a parent. So if you're not happy, you can always take it one level up.
Thank you so much, ma'am. Mr. Avanti, can you please lend your voice to what Dr. has just started? Let's get to hear your opinion on when there is no doctor or where the doctor is not responding to her responsibility, what should be more done?
Is that question for me?
Yes, please.
Okay. Yeah. I really loved what Dr. Alabi said, and while she was talking, my heart was just bubbling. And, in fact, in answering that question, I was just writing something down because from the African perspective again, from the African side of things, the way things are done there, um, I question, I question a lot of things. And one of the things I see very, very glaring is, except you have the passion for it, and you have a conscience and you have a heart. I don't, the question I ask all the time is, do our doctor really do have value for life? Do our continent, our country, do we have value for life? Because if we do have value for life, if every single person, not just the government, not just the doctors, but every individual, if we do have value for life, our perspective, the way we see life, the way we see things, the way we reason, and the way we actually take life itself will be completely different. And coming down to our doctors, if they have value for life, because I know I was speaking to a doctor some time ago, and that was just last month. Because a few of our children, they had a corrective surgery, and we brought in some doctors from from America and from Venezuela to actually carry out that specialist corrective surgery on our children. And I had the opportunity of speaking to some local doctors, Nigerian doctors, and I said to them, I said, do Africans, do our doctors have value for life? Because when you see a lot of stuff, when you hear a lot of stuff from what a lot of our parents, the children, the parents of the children that I look after, when they come back to you to relay what they've actually experienced at the hospital, taking one child or another child to the hospital, or they themselves being ill and then they go to the hospital, and how they are being treated and all that stuff, it just raise up that question over and over again. Do our doctors have value for life? If they do, they would do things differently, and they would treat humans and treat their patients differently. And again, what are the policies if a doctor actually does what is not right? When a doctor does not attend to a patient properly, when a doctor actually sideline a patient, or shut down a patient, or does medically what is not right for a patient, what policies are in place by our government or by the medical body that is holding these doctors, holding them responsible to their duties to humans, to their clients, or to their patients? What policies are there? And when things go wrong, do we actually, do the body and the government, do they actually hold somebody responsible for that? Because if they do, I think it would be a different story altogether. The narrative is going to be different. There will be less of this nonchalant attitude, and of not taking care of patients when they are in hospital, or when they come to speak to a doctor. A doctor will not be telling a patient, do you want to teach me my job? When actually the patient is the one that knows his or her body very well, more than the doctor himself, or knows the child properly 100%, that even more than the doctor himself. And a mother or a father of a child is come to you to say, oh, these are the symptoms that I can see in my child, or these are the symptoms that I'm feeling. And then the doctor is doing something else, not even giving attention to the child, or doing something else altogether. And not even when you don't know. And another thing that I've also seen with our doctors, sorry, it's just like, I don't want to be really negative, but these are my personal observations that I've seen. I lived in Nigeria more than 30 years before I relocated, and I know what I saw there. I know what I experienced. Talking from my own experience, when you go to see a doctor, they just, the way they treat the patient is not just right. And I haven't lived here. I've had the opportunity to live here to see how doctors here do, they relate to the patient, how you go into hospital and the doctors and the nurses are showing you love. Even the love alone, the love that they show you alone will help you heal and get out of the hospital quicker than what we get in Africa. So who is held responsible? What policies are there that hold these doctors responsible to hold them to their oath of, when I know when they graduate, there is this oath that they take, that they will live up to, look after patients and save lives. So that is the number one thing that they do. So who holds them responsible when things like that don't go right?
Exactly. So does that really count in a place like Nigeria? Let's say the entire Africa, such oaths being taken, do they really work in accordance with those oaths? Because we don't really see them like that. And I want to, we're being apologetic about what you are saying. You don't have to be, because what Clevenard.com actually stands for is we have a focus, to create awareness in matters of this regard, so that we can begin to make the necessary changes that will be healthy for the system. Right? We just asked a question about policies and is it being implemented in the health sector. Doctor, I'll take the question back to you. No, please, in the next few minutes, I'll get back. But doctor, I need you to come in here. Are there real policies put in place, all right, to curtail the excesses of these nurses and the doctors?
Definitely in any regulatory body, there are, processes that need to be followed. Our problem back in Nigeria is just, enforcing it. Because yes, we have a regulatory body for doctors, but unfortunately, processes are not being followed. Nobody gets, you don't even get feedback from the patient. All of this, like if I can use where I am right now as an example, there's always an escalation of dissatisfaction. So if you are, as a patient, you feel you haven't been nicely serviced by a doctor, you can always complain, one, directly to the doctor, him or herself, or to the hospital. I've gotten sometimes, there's letters that are written, to the hospital manager. And there is a disciplinary process at the level of the hospital. They would call you in and they would, hear your side and try and see how they can resolve it with the patients in. Sometimes it's just a miscommunication situation, but, at least there was an avenue. There is, since I have worked in this, I've lived here now for about 25 years, in every hospital, there is a quality control officer. And that person handles all this kind of things to make sure that the feedback they give, they get the complaints from the patient, they investigate the matter, they give a feedback to the patient so that at the end of the day, the issue is resolved. If it's not resolvable according to the patient or not resolved at the level of the hospital, they can always escalate it to the body that regulates the doctors. So again, the Health Professions Council in this country will, investigate the matter, and you are welcome to come and defend your case as yourself or get a lawyer to go and defend your case, but there is a disciplinary body, So all of these are structures that are in place. The regulatory body for doctors in Nigeria is the Medical and Dental Council, and they also have these structures in place, but how often is it enforced? So the problem really is enforcement, unfortunately. And I think that's where we need to really start speaking to ourselves that, we need to start enforcing these things. And once things start being enforced, I promise you, Nigerians know how to fall in line, so.
Whose responsibility is it to do this enforcement?
The government.
Well, like I said,
is it the government? Is it the private individual?
It's all in a hierarchy. So it should start. one thing I have never seen, I don't know since I left the country, whether they've now started implementing that. Not a single patient gave any feedback to anybody discharged from UCH or discharged from Luth. Those two hospitals that I worked in, I never saw any patient upon discharge give a feedback on their experience. So that is already a lapse. That is at the level where you now start getting, this feedback such that, people can be called to order. So this is not even government. This is just, personnel, personnel within an establishment. So it's at that level. Of course, at the regulatory body, the council, that is now taking things to government. But already from the establishment, each establishment should have a quality control department where the quality is actually maintained.
Thank you so much, Doctor, and thank you so much, Mr. Now I'll go over to Ayola, which is value for life, as rightly said by Avanti. Right. But I'll need you to lend your voice here. Replicating the diaspora standard for value for life. What is your take?
What? Come again, please.
Replicating, all right, the diaspora standard in Africa in regards to having value for life. What is your take?
That's a good one.
You stayed in diaspora. At least I know you must have had a bit of both experiences. So how do we in the sector begin to see what we see in diaspora and then start implementing it in what we have here in Africa?
Okay, that's a very good one. However, before I step into that to that question, I would like to have a bit contribution to add something to what you just said. From my own perspective, basically we're talking about healthcare here, and there's still one thing that healthcare and well-being are now integrated, and we are now speaking about it. But people are still not talking about the well-being of the doctors or the healthcare professionals. Yes, intellectually, healthcare-wise, they might be okay. Intellectually, they are sound before they could even be qualified to be a doctor. But what about their social, emotional, environmental, and occupational well-being? That is where the issue is. The doctors are healthcare-wise, they are okay, but well-being, they are not. Majority are not, especially in our country. We just have to be real with ourselves, because I've witnessed. If I bring my experience to board, it's so sad, because unfortunately, at the same time, I had two friends that had cancer. One in the UK, one in Nigeria. And frequently visiting both. My experience in taking them to the hospitals are totally different. In the UK, it was like an hotel setting. In Nigeria, I'm even talking of Lasut. I took him down to Lasut. I had a program to attend on one of the TV channels. They told us they have not even a place to put for wheelchair for us to put in. Unfortunately, both of them died. But what they went through were totally different experiences. In between, Nigeria was like, I don't even want to compare anymore. We have a lot to do. We have not even started. Because some of the doctors who need medical, psychological evaluation, they are living in an environment whereby everything is toxic to them. They're just trying their best. And some of them now have turned to entrepreneurs. They've turned to entrepreneurs. Even if you are not sick, they will tell you, okay, put them down and food drip on them. Because they need to pay for the hospital, they need to pay for their staffs. You know,
All right,
but moving
moving
forward, that is, I would not say they are. Some of them are trying their best. It's an environmental factor. Well, what I'm saying is their well-being to need to be considered. There might be they've got sound healthcare, but in terms of well-being, they are not. Irrespective of who you are or whatever it is, they are not. I'm just telling you that. Now, at any level, most of them are not in terms of well-being. So moving forward, you see, what we are talking about duplicating what we have back home is all about that has to do more with the policymakers, the lawmakers, and the regulatory bodies, as well as the enforcement. You know, that is what we need to put in place. There, well, we have those things we have some of them written, we have them written. But what about the enforcement? And until we change our collective psychic or our paradigm, until we have a paradigm shift about quality of life, we are going nowhere. That's the reality. Another people might have different perspectives, but based on what I've witnessed in my little life so far, and my extensive traveled across the globe, we have not started. We are just garnishing things on the surface. And we need to say it the way it is for us to move forward if we are really serious. And thank God for this kind of this type of platform in which professionals could come on. And people with different experiences could come up and share. In so doing, I think we're having a robust conversation in which some of our policymakers, if they can make use of it, it will be beneficial not for individual but the society as a whole. In so doing, we'll be able to have increased economic output when we have a healthy workforce and make our country to be a competitive one on a global scale. Thank you for now.
All right. My question is going to be directed at you, and she's discussing the later part of the topic itself, which is the economic value or benefit invested in these children. And what you just explained, I want to believe that the system or our leadership has not realized that there is an economic value, right? So investing in either the children's health or even in health generally, right? So let's try and say that. What do you think is the economic value of all this when government, when leaders invest in the health of community? How does it benefit a country? How does it benefit a
I said earlier on, the first thing is the human capital development, because when you have healthy children, which are more likely to achieve their full potential in terms of the cognitive, physical, and emotional development, that would definitely lead to a productive workforce, and they will contribute to a tax base of the economy. And when you have this, definitely is one gain. Then when we're now moving forward to the productive gains, healthy children will definitely grow into healthy adults. In so doing, it will reduce the burden of preventable diseases and healthcare costs in the long run for the family and as well as the country. Because in developed world, if we go to that level, if you're jobless, your healthcare is being taken care by the government, which is from the taxpayers' money. Those are the part of the economic gains, not just for us, but for the society as a whole. And when you are looking at the reduced health costs, healthcare costs, when we are talking of healthcare and well-being, investing in preventive healthcare for children, would definitely reduces the incidence of what you call it, doctor, maybe diseases, and chronic what's it called? you call them chronic diseases,
Yeah.
you know. And when those are reduced, you know, it will help in lowering the healthcare expenditure over time. Those are part of uh, the economic gains. Also, you know, an healthy child would definitely have a kind of increased educational attainment. If a child is healthy, you know, definitely the cognitive development will be sound. The physical will be great. You know, attending school absentees will be low. They will be their best. And when they grow, you know, they come out, you produce the best. You know, who can manufacture what we even call, you know, I would say, we don't even have it yet. We have, we are talking of AI now. Look at most people in AI. Go and check the school they have gone. If they are not, you know, if they are not okay earth-wise, there's no way we can have a productive society. You know, the crime rate will be high because there will be a lot of drop out of school. And when the crime rate is high, what do you have? What kind of society do you have? We have a typical example, what we can relate to. You know, look at the northern Nigeria. Most of the Boko Haram terrorists that you are saying there, because most of them are Almanjaris. You know, and because there's a correlation between healthcare and well-being, and as well as productivity. What would they produce? What would they deliver? You know, because their cognitive development is weak. And they become endangered species even to the society themselves. You know, but in the long run, healthy children are likely, you know what I'm saying, to contribute more, you know what I'm saying, to a society because they will become a skilled workforce. You know, that is what I would like to say. And the economic benefit is enormous. That is why I said it's not just imperative. It's not imperative as a social responsibility. It's a strategic decision.
Yeah.
For parents, for one and government to invest in healthcare and well-being of the children, because healthy children will grow to be healthier, articulated, productive adults in the society. And I'm living in one, and we see the way they are investing in the children. And you will even see that go to any developed country, the way they are really investing, the first thing is investing in the children, in the children, and as well, which also in the long run, you know what I'm saying, produce to take care of the adult. Because even all the pension, if they are being saved, they are not being well managed, the society will definitely crumble. Investing in children is investing in ourselves, is investing in the country to attain a sustained economy and sustainable society. Thank you.
So much, Honorable Way. And when you talk about that working in the system itself, I think I quite agree with you. A couple of years ago, we had an issue of a senior president in the country where, because the child was able to get the necessary treatment back here, the child has to be flown abroad for treatment. And with all this sort of drama that rose up in that scenario, at the end of the day, it was not favorable to even the child. And then the parents at the end of the day actually suffered for it. So it is very, very important that we begin to develop our health. I'm not here to shut that up. I would like a doctor to come in there. Only benefit of investing right in children's health. Let's get to hear your opinion, please.
Yeah, no, I agree with everything that Honorable Lawal said just now. I'm just going to add one or two extra because everything he said was spot on. There's also benefits, for the families themselves, which ultimately links back into the society. There's benefits at every level. So benefits, if I'm going to categorize them, so he took some of these benefits, kind of one by one. There's benefits for the children themselves, looking at indicators, things like improved survival rates. So when you invest in healthcare for kids, there's improved survival rates, reduction in morbidity, improvement in weight for age, so height for age. Those are some of the indicators that we look at, to actually say that this child is thriving. Then you're looking at better psychosocial development, improvements in cognitive development, cognitive ability, social development, emotional development, skills in language, things like that. All of that are the things that the child benefits from. Then of course there's less absenteeism in school, like he said. So generally there's improved attendance, improved performance of the child. A healthy child goes to school. One thing I love about kids is they always want to go to school, but they will go to school, because they will go to school because they're healthy. So even for the siblings themselves, the family, at family level, the siblings also benefit, because now you find this child, if you had a sickly child, for instance, the siblings suffer, but so when there's so much investment in a child, even if it's a child who's got a chronic condition, but is being well managed to the point that the child is actually getting, living its best life with that condition, then the siblings are happy. You find that the siblings attend school more regularly, they perform better, there's long-term, earning capacity, when the siblings, grow up. Then, of course, to the parents themselves, then you find that a child who is healthy, has the parents are less stressed up. So they are generally happier people. They contribute better to society. They are able to work. When you have a child who is not well, or a bunch of kids who are not well, somebody opts to stay at home, that already reduces the family income. So there's benefits at that level. Then you now go into the community. There's changes in the physical environment monitored by improvements in sanitation. Those are things, indicators that we'll be looking at, that are there part of the development, part of the investments. You remember when Honorable Lawal was talking about the investing in the emotional well-being, in the psychological well-being. Part of the things that will be done is to produce, provide play areas for the kids, improve the sanitation in the environment. So all of that affects the community, because now they have, living spaces. There's, parks for the kids to go and play, parks for families, to go and express themselves and things like that. Then, of course, reduction in the number of children needing to repeat grades, reduction in dropout rates, things like that, because the kids are generally healthy. It makes the institution look good. An institution that has lots of dropouts and lots of, people who are not completing, they don't have good numbers to show, So if the kids are generally healthy, even the institutions, the schools themselves, it makes them look good, because now all their kids are doing well, their kids are finishing, they are having good outcomes when they, publish their statistics. And then ultimately to the society, Honorable Lawal had touched on all the benefits to the society.
Thank you so much, Ma. Please let's get to it.
Yeah, I think every point has been touched, really. And while I was just looking at the whole thing, I think what I just want to add to it is to say that the greatest asset that a country or a continent can have is healthy children. Because once they are healthy, they will be able to, put in their own input in the growth of the economy of the country. And while they are healthy, their parents are able to go to work, to work and also add their own quota to the growth of the economy. Because if you have a child that is ill, just like Dr. Alabi said, the parents have to stay at home. I remember a lot of times that I have to, while I was working and my son is, is not feeling too well or had a fracture, I had to stay back, or my husband had to stay back. And I know how much that's really impacted on our finances in caring for our children, on our finances, on putting food on the table, not to talk of the whole society as a whole. It is so, the disaster that causes when you don't, when children are not being, their health care or their health is not being looked after, is just too much. It's too much not to invest in it. It's just too much. Just looking at the whole thing, while I was doing a bit of research, because also I'm also in uni studying psychology and counseling therapies, and you just look at the behavior of a lot of children. If you compare a child that is well fed from the house and a child that is not well fed from the house, or not even seeing food at all, not getting any food to eat, they become robbers. They are not satisfied with what they get because it's not there anyway. So the behavior of that child, when you compare both children, you will see it is very glaring that one is not doing well and one is doing well. Even in educational aspect of it, their cognitive is really very low, especially when they are not from when they were in their mother's womb and giving birth to, there is no proper nutrition. You will see the difference. It is very, very vast. It is very, very vast. When we compare our world in Africa and the world here in the Western world, if you compare our children together, let's be honest here, we see the difference. A lot of our children are being kind of timid, they are withdrawn, they are not, the social life is not there. And that's because, their health is not 100%. Compared to the Western world, their children are outspoken, they are very, playful, because all those therapy are put in place from beginning, from when they were born, even before they were born, the sensory aspect of things, when the mothers have them, begin to play with toy. A lot of children in Africa don't play with toy. They don't even understand. They don't even know what toy is, and that's because they cannot even afford it. So if our government can come in, I know it is the responsibility of every single person, and it is true, it is the responsibility of every single person, because it's a process and in different stages. The government has got a role to play. The parents have got a role to play. The society has got a role to play. And there are a lot of studies to show that the importance and the benefit that this, investing in children's health care is out there. It is so enormous that we cannot even, finish it today. And as I was just to conclude, as I was just looking through and just putting notes together, what I came across was preventing undernutrition in children help the children learn better in school, which can translate into at least 20% in homely earnings and at least 48% in wage rates. So when you can imagine the figures, you can imagine the numbers. When we have a proper health, we invest in our children, the health of our children, it goes a long way. They will be able to, give back to the society. Their parents will also be happy to then go to work and then put a lot into the economy, in terms of finances, in terms of wages, and giving back to the government and all that stuff. So I think it is very, very important. if you is like saying if you educate a girl child, you educate a whole nation. If you educate a child, you educate a whole nation also. So whether being a boy, whether being a girl, it doesn't matter. It is the right of every child to have good health. It is not just a need, it is not just a want, but it is their right. And once we begin to understand that it is the right of the child, then I think we will do, when we have that different perspective, we'll see it from that perspective, from that angle, we will be able to do more for our children. Thank you.
That I did and try to do a little analysis on the OI. I will not permit us to go into that, but that's actually had to bring it up at the beginning this interview. So I'd like to, I don't know if you can do that, have another episode of this.
You're very far. I can faintly hear you. Sorry.
Yeah. We're also struggling to hear. Yeah.
Oh, seriously. Am I okay now? Is it good now?
Yeah, I think move your headpiece closer. The mouthpiece of your hands free. Move it closer, please. Try that. Maybe it will work.
Is it okay? Am I okay?
Yeah, I think yeah. On my side is better a bit.
Doctor, are you okay?
It's better, yes.
Sorry about that. So what I was saying is that at the beginning of this interview, I tried to let us have an overview of what OI is all about. But somehow I had to begin because I discovered that we had to go into that. The main topic of discourse, we might not have time to discuss that. Actually, just be discussing for the past hour, very valid. I would also like to have, you can make this a series, all right? Make this episode in series where we come back and then itemize these ailments that can affect children right from that age of birth till about that 15 years. It will be a very good thing because I really wanted this to talk more on the OI. I think it's very, very important that we begin to discuss that because I don't think many parents are even aware of an ailment like that. So most of us just give birth in the hospital, you take the child home, 2-3 years, you are afraid that the child is unable to walk. Why? Because we've not known even anything about the cause of such a event rather. So I don't know if you're okay, maybe the director will have to liaise with you on that. We can come back and examine these topics and then let's try to trash it out and let's see what parents can start doing in containing these exercises and then what the medical friends and professionals should be doing as well, and even the government should be doing as well. But for today, we'll draw the curtain here for today, and I want to thank Dr. Olubomi Alabi for being my guest this evening. Thank you so much for being with us this evening.
Thank you very much for having me. Thank you to all your listeners as well.
This invite again to speak on this information. I can't just imagine how difficult it was for you to have said one or two things in this regard. But thank you for being my guest this evening.
Well, always my pleasure, and thanks to my co-guests. Very, very interesting and educative people to be around. Thank you. Nice to meet you guys.
Thank you, sir.
Thank you.
Agonte, thank you so much for your time and thank you for what you are doing with the OI initiative. Thank you for being here.
Thank you so much for having me. Thank you to all our listeners, and thank you for giving me the platform to actually to talk about OI and brittle bone condition, and to just to get people aware, because I know that ignorance is a huge barrier and a huge disease. So when I get opportunities like this to come on board to talk about this condition, it is a huge opportunity for me, and I don't take it for granted. So thank you very much, and thank you to all the listeners that are out there. I've just listened to my voice and just staying on with us to listen to this discussion. Thank you so much. Thank you to all the speakers too.
The audience will draw the curtain here for today. Please, we're going to take into that episode. We're going to be discussing just Mr. Gonte on OI and is resultant. The next edition will we come your way with other guests on this program. Don't forget that Clevenard.com exists to just create awareness